Good morning. This is Medications, your first psychiatric consultation. Today, I'm going to discuss the number needed to treat, to give benefit, and to cause harm for antipsychotic medications. The CATIE trial of antipsychotics looked at olanzapine, quetiapine, ziprasidone, perfenazine, and risperidone. The CATIE trial determined that it was necessary to treat about 6 patients with olanzapine to find one patient who had significant benefit to continue the medication for 18 months. The CATIE trial determined that it was necessary to treat 7 patients with ziprasidone to find one patient who had sufficient benefit to continue the medication for 18 months. The CATIE trial determined that it was necessary to treat about 9 patients with perfenazine to find one patient who had sufficient benefit to continue the medication for 18 months. The CATIE trial determined that it was necessary to treat about 11 patients with risperidone to find one patient who had sufficient benefit to continue the medications for 18 months. The 5, 6, 7, 8, and 11 patients who did not find it worth their while to continue olanzapine, quetiapine, ziprasidone, perfenazine, and risperidone found the lack of benefit and the pain of the side effects did not justify further time and money taking these medications. Research in psychiatry is fuzzy, and I suggest that the reader review the following article to understand the fuzziness of research in psychiatric medications. Schizophrenia, Clinical Antipsychotic Trials of Intervention Effectiveness, CATIE, and number needed to treat, how can CATIE inform clinicians? This is by L. Citrome, T. Scott, Stroop. After a failure of one trial of medication, the number of patients to benefit from another medication trial increases and the failure rates increase. After a failure of one trial of medication, the number of patients who suffer adverse side effects decreases and the number of patients needed to find an adverse side effect decreases. Continuing medications with antipsychotic medications after a failure of the first trial is a path toward futility. Clozaril is the gold standard and waits at the end of this path of futility. A study regarding the number needed to cause death among demented patients revealed haloperidol had a number needed to harm of 26, risperidone had a number needed to harm of 27, olanzapine had a number needed to harm of 40, and quetiapine had a number needed to harm of 50. The harm in this case was death. The elderly are playing Russian roulette with antipsychotics and dying at the rate of 1 of 26 for Haldol to 1 out of 50 for quetiapine. Another study reveals that after recovering from a first episode of schizophrenia, patients have a lower relapse rate for the first 2 years if placed on maintenance medications. However, patients taken off of antipsychotic medications have a higher recovery rate after 7 years. What actually is being measured? In the first 2 years, patients on maintenance medications probably have more hospital admissions. However, they are not actually recovering. The patients taken off of maintenance medications are actually recovering despite a greater number of hospital admissions as compared to the maintenance medications. Medications do not cure the underlying mental illness. The alternative treatments pursued by the patients taken off the maintenance antipsychotic medications are in fact effective in restoring ability to function. That would be psychotherapy, meditation, deep breathing, exercise, work, social activities, and other alternatives. It has been determined that after 7 years, patients who reduced and discontinued their antipsychotic medications had a 40% functional recovery compared to a 17% functional recovery for patients placed on maintenance antipsychotic medications. The short-term benefit of maintenance medications is fewer hospital admissions for the first 2 years. However, they only have a 17% functional recovery after 7 years compared to the patients that stopped the medications with a 40% functional recovery, but more hospital admissions during the first 2 years without medications. I suggest the reader review the article Recovery in Remitted First Episode Psychosis at 7 Years Follow-Up of an Early Dose Reduction, Discontinuation, or Maintenance Treatment Strategy. Long-term follow-up of a 2-year randomized clinical trial by Lex Wunder, Inc., MD. Tomorrow, I will address the issue of meditation as a treatment alternative. Thank you for your time and your kindness. Have a great day.